You guys, it is testing insanity around here. The CDC guidelines keep changing. There are some new tests that have come on the market, and you are probably wondering, what should I do? When should I get tested? And what does a test mean, whether it's negative or positive? I'm Dr. Darria, and today we're going to talk all about that. You know, I'm your on the front lines emergency room doctor, taking care of patients with COVID and everything else. I'm a mom of two, and I am here to bring a little science and sanity to your life and answer your questions about COVID and everything else. And today we are talking testing. Now, before we get into testing, I know a lot of you have questions, what are all these different kinds of tests? So I wanted just to do a quick rundown of where we are right now and what are the different options. There are 3 different categories, and the first 2 help you know if you acutely, right now, have the coronavirus infection. The very first category is called an antigen test. Now, sometimes you may have heard of this referred to as a rapid test. The second category that I'll talk about in a second can actually also be rapid, but often in the colloquial, this is the rapid test people are talking about. This is usually taken either from the front of your nose or the back of your nose, aka the brain swab that people talk about. And the advantage is it is faster. It usually takes under an hour. It also tends to be a little bit cheaper. The trade-off is that it tends to be a little less accurate. Now, if you get a positive result on an antigen test, you most likely do have the virus. But if you get a negative result on it, it's around a 20 to 30% false negative rate. That, of course, depends on the test. It also depends on where you are in terms of the infection and how much viral load you have in your body. The antigen test has to have enough viral load in your body for it to be able to pick up the virus and to say that you have a positive result. So there's your antigen test. It's faster, it's cheaper, but it's often less accurate. Second category is what's referred to as the molecular. Sometimes you've heard it referred to as nucleic acid or PCR. What this test is looking for is actually DNA of the virus. And since part of the process of PCR is to very rapidly amplify the number of virus in the sample, it tends to be more accurate because it can pick up even smaller viral loads in people. So what are some of the features of this one? Again, you can get it from the anterior nose, you can get it from the posterior nasopharynx, and there are some tests coming out in the saliva. Most of them are not commercially available, but that'll be great because they will be cheaper. So that could be changing the conversation. But in terms of cost, most of the molecular ones tend to be more expensive, and they do tend to take longer. Many of them are these ones that you're seeing that take 1 day, 2 days, 5 days. Of course, that's in part due to the backlog. So most of them take 1 to 2 days to run. Now, of course, there is one test. There are tests that are rapid molecular. So rapid does not necessarily have to mean antigen. There are rapid molecular tests. They still tend to be more expensive. The third category is antibody or serology. This was really talked about several months ago when the thought was you could get a positive antibody test and you got your passport to fly and do whatever you wanted because you now were immune to COVID. A lot more data we've gotten since then has kind of poked holes in that goal. So right now it's useful to know if you have been exposed, but for how long you have immunity and how complete it is, that we don't know. And there was one recent man out of Hong Kong who seems to have gotten a secondary infection of COVID. Now it seems he got a different strain, but it means that there's a lot of questions, and an antibody test itself that is positive does not necessarily mean you have a passport to go do whatever you want. So those are your test kinds. Now you probably have questions. What is this new CDC guidance? So all along, we've been saying that we need more testing. More testing is good. Well, just the other day, the CDC changed the information on their website to say that if you have been exposed to coronavirus and you are asymptomatic, that does not necessarily mean that you need to be tested. And the rest of the world said, pardon me? So let's dig in a little bit. So when you read more, they said it means you do not necessarily need to be tested unless, there's always an unless, right? Unless you are a vulnerable population, unless you talk to your doctor or the public health officials and they deem that you should get tested. And thirdly, a negative test does not necessarily mean that you will not develop the coronavirus infection. Sounds like the end of those pharma commercials. They have all those people speaking really rapidly, giving you the disclaimers. I mean, really? So to listen to conversations since then and try to back out what I hope they were meaning. We've heard some people say from the CDC and HHS say that they were concerned that if you got a negative test, that people thought that was a license to have risky behavior. So I don't know what that is, risky behavior, if it's like risky business, somebody called Tom Cruise, but That's what they said, that they thought people would just go about and be irresponsible. Number 2 is that there really was just a backlog in testing, so they were just deciding that maybe we should tell these people not to get tested, which we should explain to people. We shouldn't just change the recommendations. So here's what I want you to do, because I know, again, you need science and sanity, you don't need sound bites. And so here's what you should do for yourself, for your family, in a couple different scenarios. Say scenario 1, you are exposed to somebody who find out had coronavirus. What you should do is, yes, you should get tested. Put those guidance away. You should get tested and try your best to get tested. I would recommend waiting around 4 to 6 days after you've been exposed and then to try to go get tested. You want to wait 4 to 6 days because that's usually the interval that it takes to build up enough viral load to be having an accurate test result. During that time, however, you need to be isolating and quarantining yourself away from people. Do not go to parties, do not go to restaurants, do not go to work or school or any of those things. You need to be isolating yourself and then get tested. If you have a negative test, I'm in general telling people that a negative rapid test should be followed up by a PCR, especially if you're symptomatic. We may learn more as these rapid tests become more and more accurate, but now, in the absence of other data, that's what I'm saying. Scenario 2, you are symptomatic for COVID. What should you do? Yes, you should get tested. And again, if you get a rapid test and it is negative, guidance right now that I'm recommending is that if you get a negative test, you should still back that up with a PCR to confirm that it is negative. But since the tests still aren't perfect, and since we still have so many questions about COVID, most places are recommending, and I do too, that even if you have a negative test, you should still isolate for 10 days since your symptoms started. Yeah, this all seems really strict, but remember, what we need to do right now, y'all, is we need to be initially hyper-vigilant. If we can be initially hyper-vigilant right now, and we can get information, we can get data, we can get a handle on the coronavirus pandemic, then we can slowly start to lower restrictions. But we first just got to get the economy moving. We got to get people back to school. So initial hyper-vigilance. So that's what you should do if you are exposed but asymptomatic, or if you are symptomatic. Now, there's one third case I think is really interesting, and I think there's room with the rapid antigen testing and then potentially with the rapid saliva testing if it becomes commercially available, and that is for asymptomatic surveillance. This could be great for schools, for businesses, hospitals, any number of places to be able to do so. Now, of course, these tests, again, the rapid ones tend to be less accurate, but if there's recent research that suggests that if you can get it done in a way that is slightly less accurate, but it's cheap enough and easy enough and rapid enough that you can do it very frequently on a weekly basis, or in some places every couple of days, depending on different use cases, then you are going to stand a much better chance and you're much better off than just doing the more accurate PCR on longer intervals. So I think there's a lot of use for these rapid antigen and maybe the saliva tests, these very rapid, cheaper tests to allow us to do much more frequent testing. Bottom line, more testing, more data is what's going to get us out of this mess and back into the world where we all want to be. I know all these headlines constantly changing is confusing. That's why I'm here to bring a little bit of science and sanity to your life. Please share this with anybody else who needs it, whether they're having questions about testing themselves, their family, or testing their employees, or testing a school, to give them this latest information. Please also let me know what questions you have, what comments, what else are you wondering when it comes to COVID and testing, or COVID and anything else. You know I love to hear from you. I love to be able to answer your questions. So please definitely let me know, and please share this. I'm Dr. Darria, and I'll see you next time. In the meantime, take care of yourself and stay well.